endocrine videos. Again, I filmed these because I am terrible at the endocrine system. I hate the endocrine system, so doing these videos helps me to remember and learn. So we're going to be talking about the common conditions for the endocrine system. I'm only going to be going over the 6 that are on the common conditions document on D2L that Dr. Mack has posted for us. And we're going to be doing kind of like a concept map situation, or at least I am, and you're going to follow along. So we're going to start with acromegaly, so acromegaly is in adults, gigantism is in children. And let me put here in black. So acromegaly is in adults. That's gotta go down. So this is after the growth plates are done. And this is in children, gigantism. And that's before growth plates fuse. Alright, so let's discuss the causes of acromegaly. So mostly it's almost always caused, so acromegaly is an overproduction. Don't like how thick that is either. I apologize. Okay, acromegaly is an overproduction of growth hormone. Okay, and if you remember from my last video, or if you didn't watch my last video, growth hormone is produced in the anterior pituitary. It targets muscle and bone. It's what helps us grow. Normally, there's a negative feedback loop. The hypothalamus stimulates or releases regulatory hormones to stimulate the production of growth hormone, and then in a well-functioning pituitary, it'll secrete a certain amount, it'll stop, let us grow a little more, and then it'll eventually stop when we've reached our full height, right, or our full adult size. In acromegaly and gigantism, it's almost always caused by an adrenal or an adenoma, which is a benign pituitary tumor. Okay, and that's what causes acromegaly and gigantism. Certain rare tumors of the pancreas and the lungs can also cause this, but it's almost always adenomas, which is in the pituitary. Okay. Symptoms. So actually, let's talk for a second. Acromegaly in adults is almost always fatal because it has complications in the cardiovascular, cerebrovascular, and respiratory disorders. So it's pretty fatal. And then, alright, so let's talk about symptoms. So the patient will come to you, we've got subjective and objective symptoms, right? So, dropped my phone. So obviously they're going to be tall. There's going to be an overgrowth. Right, they're going to be pretty big. In children, sometimes it might not be as obvious as in adults, just because we're going through this rapid growth as a child. And even in adults, it takes about this common conditions thing says about 7 to 10 years to reach a diagnosis, because it's not like you're going to spring up overnight. It takes time. And so one of the books I read suggests take a picture every year to help establish the diagnosis. So it's not going to be something that's just, from one year to the other, you're going to be like, whoa. Or from one visit to the other. Okay. So they grow to great stature. Their arms and legs lengthen. In children, we might see delayed puberty. And the genitals may not develop. Fully. Okay. So in most cases, the excessive production of growth hormone is most common in between 40 to 45 years old, and it's most common in males. So in adults, so this is overgrowth is in children, right? Because they're still growing, their growth plates are not yet fused, so they're going to be really tall, and their long bones are going to get really, really long. In adults, though, because our growth plates are already fused, we're going to see deformities. So in adults, overgrowth equals deformities because our growth plates have already fused. So we're going to have the rest of this is going to be in adults, okay? So we're going to have coarse facial features. So I don't know if you guys have ever seen The Princess Diaries, but think of Andre the Giant or Fezzik in The Princess Diaries. If you haven't seen it, just look up Andre the Giant. That is a classic case of acromegaly. Big, coarse facial features. Hands and feet are swollen. Hands and feet are swollen. They're going to have larger rings. They're going to need larger rings, gloves, hats, shoes. Everything's going to be have to be custom made. Overgrowth of the jawbone can cause protrusion of the jaw, and so that's called progantism. So protrusion of the jaw. And again, I'm just thinking of Andre the Giant. I should look up a picture, but I'm just thinking of Andre the Giant again because, here we go. Let's look up a picture. Let's go here. It's really gonna help, I think, bring this picture home. So he was actually a wrestler, but he was in pain a lot because, it's a very painful disease. So, here we go. You see here, you see his laser pointer. You see here his jaws protruding, swollen hands. He's got kind of a deformity here of the chest, you can kind of tell. And his forehead is protruding. Here you can see the jaw protrusion. Here's a picture with like a regular guy. You see the swollen hands and feet, and just like the kind of like the deformity that he's got here. So that's a classic picture of acromegaly in an adult. So then, oops, don't need the laser pointer anymore. There we go. We're also going to have a deepening of the voice, or a deep voice, because of overgrowth in the larynx. The ribs are going to thicken, creating a barrel chest. So again, you saw Andre the Giant, he had that kind of barrel chest look. And joint pain is going to be common, and after many years, it's going to go to crippling arthritis. And from a lot of things that I've read, Andre the Giant, like I said, was in a lot of pain. If you see him in that movie that I talked about, Princess Bride. He kind of walks with a limp. He was in a lot of pain. And he died pretty young too, just because of cardiovascular issues. It can cause cardiovascular issues, respiratory issues. First of all, cardiovascular issues, because now the heart has to pump blood for a much larger body, and that can cause heart failure. Also, the overgrowth of growth hormone, it does target muscle, and what is the heart? A muscle, so that causes it can cause cardiomegaly, hypertrophy, end up in heart failure, that kind of thing. You're going to have respiratory issues because barrel chesting, deformities. The lungs can't expand the way they're supposed to. Again, they're having to perfuse a lot more body mass. All that kind of stuff really takes an impact on the body. These people tend to die young if we can't get it fixed. Enlarged tongue, coarse body hair, which darkens, the skin thickens. Okay. So, like I said, heart failure is going to end up happening, loss of visual field, headache. Women with acromegaly have irregular menstrual cycles, if they have one at all. They might even produce breast milk, even though they're not breastfeeding, which is called galactorrhea. And then erectile dysfunction for men, hypertension, diabetes, sleep apnea, heart failure, and tumors, which can become cancerous. And life expectancy is, like I said, severely reduced. So now, and I kind of talked a little bit about diagnosis. Like I said, in children, it's usually not super abnormal. This rapid growth is not abnormal at first, but then we do see abnormal growth, and they start to hit those percentiles and go above those percentile ranges. With adults, the changes are slower, so that's when you want to take the serial yearly photographs to establish a diagnosis. X-ray of the skull may show thickening of the skull. And overgrowth of the bones. So then we confirm with blood tests. Obviously, we're testing for those growth hormone levels, insulin-like factors, or insulin-like growth factors. And then a CT scan will usually show the abnormal growth of the pituitary gland. A CT or an MRI to get the adenoma. Okay. For treatment, it's very difficult because it's such a, and we don't really have to know treatment, but I'm going to go over it anyway. It's basically surgery. Radiation, and drugs. Surgery, we're trying to cut out that adenoma. Radiation to help reduce the size, and then drugs to help to lower the growth hormone factors. So that's acromegaly. And I will go over the rest of these later because I've only had 3 hours of sleep, so I'm going to go take a nap and come back to and we'll continue with hypothyroidism and hyperthyroidism, and the other two, which is Cushing and Addison's disease. Yep. So we've got 5 more to go. I'm not going to do diabetes. I think this has been, it's a dead horse at this point. Or beating a dead horse. All right.